All right, folks, let's go ahead and get started. Today, we're very honored to have Dr. Muhammad Usama, board certified sleep and wake physician, educator, and thought leader at the intersection of clinical sleep medicine, health tech, and innovation. As always, this podcast is for informational purposes only and is not medical advice. Dr. Usama, honored to have you here today. Uh, let's go ahead and get started as we usually do with what I call the Batman origin story. So tell us, how did you become a sleep physician?
That's an interesting question. I get that all the time. So, I didn't plan to be a sleep doctor. I fell into it the way many people fall into sleep problems, which is unexpectedly. So, my journey sort of started during my residency training. And during that time, it was when I realized that how often patient heart, brain, and metabolic problems they were tied to poor health. So I was just working in my residency clinic, and I encountered a lot of patients with difficult to control blood pressure, difficult to control diabetes, and I screened them for sleep apnea, and then sent them to the sleep clinic. And after that, I was much easily able to control their blood pressure, their blood sugars, their daytime energy improved. And I was just curious that what kind of magic is happening in that sleep clinic. So I just took an elective into that sleep clinic, and um, uh, over there I realized that how intricately sleep is linked to all these other problem, and how it's sort of like the base of metabolic health. And I was very fortunate to have worked with a lot of experts in the field over there, and they kind of like ignited the passion for sleep medicine in me over there. So that's how I became a sleep physician. But in short, I feel like I stood on shoulder of giants, and I learned a lot from them. And it's not just sleep. I call myself a sleep and wake physician because my work is not just about treating sleep. It's also about optimizing wakefulness, cognition, performance, and longevity.
Uh,
And all these are linked to sleep.
yes, sleep is top of stream. Let's talk about the evolution of sleep medicine. Now that sleep is starting to get the attention it deserves, it's easy to forget that sleep science is a relative infant compared to several other scientific and medical disciplines. When Nathaniel Kleitman wrote his seminal text, Sleep and Wakefulness, in 1939, you could almost literally fit everything there was to know about sleep in one book. Could you please walk us through the evolution of sleep medicine and what all that involves?
Yeah, absolutely. So, sleep medicine is really one of the youngest fields in all of medicine, and it's a very close knit community. There are not a lot of sleep physicians in the whole US, and all of us we know each other. But yeah, getting back to your question, if you go back to 1939, Nathaniel Kleitman he wrote this book, Sleep and Wakefulness, and at that time, what we all knew could be fit into one. Textbook. But it's hard to imagine today when we have thousands of new sleep related studies being published every single year. So now PubMed adds about 5,000 sleep papers a year. So and it's interesting, how far have we come. So in 1950s there was actually discovery of REM sleep by 1953 to be exact, by Kleitman's student, which was Eugene Asudensky, and he identified rapid eye movement. And this was revolutionary at that time because it showed that sleep was not a passive rest but an active dynamic process. And that discovery laid the foundation for linking dreams, which happen during REM sleep, brain activity, and memory. So the discovery of REM sleep, it showed us that sleep is not shutting down, it's gearing up for brain health. And REM, if you talk about REM sleep, it's really fascinating form of sleep in which brain is most active, but our body is paralyzed. And that is because we are dreaming and nature developed a protective mechanism. So we don't act out our dreams. And that is why the body is paralyzed. And there are different diseases of REM sleep in which that protective mechanism is lost. And those people, they start acting out their dreams. So, particularly in REM sleep behavioral disorder. But yeah, after that in 1970s, researchers like Christian Guillemin and William Dement, they started identifying obstructive sleep apnea. And at that time, suddenly what just looks snoring turned out to be a serious disorder leading to hypertension, heart disease, and daytime crashes. And this is when the sleep labs they started opening across the US and Europe. So it was at that time that sleep apnea turns snoring from a bedroom nuisance into a global health crisis. Moving forward in 1980s to 1990s, it brought sort of better understanding of insomnia, narcolepsy, restless legs, and other circadian rhythm disorder. In 1990s, we discovered genetic underpinning of narcolepsy, which linked orexin, which is a chemical in our brain, also called hypocretin, the deficiency of orexin and hypocretin to narcolepsy, and one of its seminal symptom, which is cataplexy, in which people lose their body tone. So that was huge at that time because it meant that sleep disorders were not just behavioral but deeply biologic. Um, Talking about 2000 to today, so in the last 2 decades, the science literally has exploded. And now we know that sleep is intertwined with virtually every field of medicine. It's linked to cardiology, like diseases of heart, in which untreated sleep apnea, it increases the risk of heart attack and atrial fibrillation. It's linked to diseases of brain and field of neurology, in which poor sleep can accelerate dementia risk, and it can worsen stroke recovery. And it's very closely linked to psychiatry, in which insomnia is both a cause and consequence of depression and anxiety. It is linked with our metabolic health and metabolism. As we know that short sleep, it doubles the risk of obesity and diabetes. So during past 2 decades, I would say that sleep went from being a lifestyle choice to being recognized as a vital sign of health. So, so yeah, and now we are in digital eras. We have wearables, home testing, telemedicine, and AI-based scoring, which are transforming access to care. We also begun to see public health shift, like later school start times, and society finally realizing that sleep affects safety, performance, and learning.
Oh yeah, absolutely. Next, we're going to dig into the public health consequences of sleep and poor sleep later today. Before we do that, though, sleep hygiene. At this point, everybody who's been following us knows how important sleep is. Give us your take on sleep hygiene. What everybody should be do to get the optimal amount of sleep, and how much is enough? How much sleep should we be getting?
Yeah, so when people ask me what's the one thing I can do tonight to improve my sleep health, my answer is almost always the same. Fix your sleep hygiene because it's the foundation. It's like brushing your teeth, but for your brain and body. And sleep hygiene, it's not the cure for every sleep disorder, but it is the entry ticket to healthy rest. So, how do we define sleep hygiene? So, it basically refers to our behaviors, environment, and daily habit that promote quality sleep. So, um, if I talk about, so let's start with the health. So, I tell everyone, like, there are three basic pillars of health, which are, nutrition, exercise, and sleep. And then sleep has three pillars of its own. So first of all, we'll start with the so those three pillars are quality, quantity, and timing. So let's start with the pillar of quantity. So most adults, they need 7 to 9 hours of sleep, according to American Academy of Sleep Medicine and CDC. Yet a third of Americans, they don't get enough sleep. So this is something like, we really need to work on. So at least getting like, 7 to 9 hours of sleep. That is very important. Then there is quality. So quality, we can there are a lot of things that impact, the quality of sleep. first of all, it is like, if we have any diseases of sleep or sleep disorders that are impacting the quality of your sleep, which could be obstructive sleep apnea or restless leg syndrome, interrupting your sleep. But other than that, there are some things which are in our control that we can do to improve the quality of sleep. And I divide those into sort of like, three phases. So things we can do before sleep, things we can do during sleep, and things we can do right after we wake up from sleep. So before sleep, one thing which we can do is that just keep our bed for sleep and intimacy only, not for Netflix or email. Very important. And then in the evening, dim the lights, avoid blue light screens 1 to 2 hours before bed, because there is evidence that those phone screens, they suppress melatonin that can delay sleep onset by 30 to 90 minutes in some studies. Because our body is not a smartphone that you can just put on airplane mode and restart at will. It runs on rhythms, not on randomness. Um, Other than that, other things we can do before sleep is to avoid exercise about 2 hours before sleep. Avoid eating any heavy meals immediately to after before the sleep. And then there is a big role of caffeine. We should avoid delay, late caffeine, because what caffeine does is so let's back up. So what causes sleep is a accumulation of adenosine, which is a chemical in our body. And what caffeine does is it blocks that adenosine receptor. So it promotes like, alertness or wakefulness. And it has a half life of about like 5 to 6 hours, something like that. So essentially, what that means is that if I drink a cup of coffee at noon, in about 5 to 6 hours, around like 5 p.m., there will be still half of that left in my body. So ideally, caffeine should be avoided afternoon at all. I only take caffeine right after I wake up as part of my pre-exercise workout, drink. After that, I don't take any caffeine at all. So that is something that should be avoided. Avoid late naps, because as I told you that there is something that develops in your body throughout the day, which is a sleep pressure caused by that adenosine accumulating. But if you take a 2 hour nap, 4 to 6 p.m. or something like that, you just lose all of that pressure. It's just like deflating a tire. You understand what I'm saying? And so that can definitely help avoiding those late naps. Um, and then avoiding alcohol before bedtime or near bedtime. And this is a subject which is really touchy to a lot of people. But I mean, honestly, people ask me what's the best time to drink alcohol. And the thing is that the alcohol, it tricks you into believing that, it causes, it makes it easy to fall asleep, because it acts through a pathway in our brain which makes you drowsy or groggy. So people feel like that, it's helping them to fall asleep, but actually what's it doing is it just making you drowsy. But once it starts metabolize, and it suppresses the REM sleep, which is a deep and restorative sleep. And once it starts metabolizing or eliminated from your body, then you start getting that REM rebound. You start getting those nightmares, and it really, really disrupts and bulldozes your sleep architecture totally. So that should be avoided near bedtime. Unfortunately, as society, most of the people, they are drinking in the evenings after finishing work. So I don't know what's the solution for that, though. And so coming back to, so we talked about things which impact, which can promote healthy sleep or more restful sleep, things which you can do right before sleep. Then there are some things which you can do during sleep, like, your immediate sleep environment. So your sleep environment, it should be dark, cool, and quiet. I tell my patients that we should take some inspiration from bats regarding sleep. So try to sleep like that because their environment is very dark, it's cool, and it's like, there is no noise. You can consider blackout curtains. You can to mask the artificial light or the outside light coming in. You can consider white noise machines because they suppress the arousal. They kind of mask the outside noise. Uh, Talking about temperature, 65 to 68-degree Fahrenheit is optimal for most. And then there are some things we can do after sleep once we wake up. So in the morning, it's very important that right after you wake up, you get bright light, which is ideally sunlight, about at least 20 minutes of exposure. Outdoor walking, you can do that. So it anchors your circadian rhythm, it improves your mood. Um, Exercise, it has been shown, there is strong evidence that if you do it early during the day, once it promotes nighttime sleep, and second, it promotes your daytime alertness, and it gives your body cue that, it's time to work, it's time to wake up. So I tell everyone that morning light, it's like nature's coffee, and evening light is or lack of evening light, I should say, is like nature's sleeping pill, but only if you use them right. So yeah, those are the things about quality, and then I'll go to timing. But do you have any questions about quality part so far?
No, that was very thorough. I appreciate your breakdown. So yes, timing.
Yeah, so the last thing is timing, which is the most underscored and most missed piece of or pillar of health. So it's very important that we go to bed and wake up at the same time, including weekdays and weekends. There was a study which published in 2017 in a sleep journal, which showed that irregular schedules, the increased risk of obesity, diabetes, and even depression. And because what essentially is happening is that if you're not going to bed at a regular time, and if you're not waking up at a medical time, it's just like you're traveling from coast to coast. So your body's in sort of like, perpetual jet lag, because what really drives our sleep and waking up is the lowering of core body temperature. And depending on, like, what time we get that light exposure, whether that is below the before the core body temperature minimum or after the core body temperature minimum, it alters our whole circadian rhythm. So when I say, like, it's very important to get sunlight or bright daylight or any sort of, if you don't have sunlight, artificial those bright light lamps, more than 10,000 lux after you wake up, because if you give that yourself that light exposure after your core body temperature minimum, that kind of, like, anchors your circadian rhythm. So it pushes back, like, it advances your sleep phase, like, it makes it easy for you to go to sleep earlier and wake up earlier, as opposed to if you get that very exposure before your core body temperature minimum, that pushes your sleep forward, so you go to bed late and you wake up late. So you can imagine, like, what waking up at a different time over the weekdays versus weekend, and getting that light exposure during different times of the day, how it can really impact your not just the sleep schedule but whole body circadian rhythm, particularly people who are staying up late at night. That means that they're getting a lot of excessive light, which is going to impact their circadian rhythm as well.
Well, that's fascinating. I like your analogy to the smartphone. We're not just smartphones. You toggle sleep on and off. That's these systems need to be trained over time. So I think that's
Yeah.
brilliant
Yeah.
analogy.
Before you go ahead, I would like to ask you, what is exercise hygiene?
What
What are
is
the exercise hygiene? What are the things we can do before, during, and after exercise to, uh, perform best?
Oh wow. So I didn't the interviewer has become the interviewee. Uh, so yes, just briefly before I would say you want to warm up. So I don't, we don't, you don't have to get too crazy, but I try to avoid what I call mindless warm up. So just doing jumping jacks or running on the treadmill. That's not terrible, but I like to use whole body movements. I could give you all kinds of examples, but side shuffling, skipping, bear crawls, things like that. Those are the types of things that are going to force your nervous system to act in unison. Gets all the systems, the organs, the muscles of the body pumping. So that's before. Have a mindful warm up as opposed to a mindless warm up, and then during, make sure you're focused on the workout. So one of the things that bothers me to no end is people texting on their dumb phones, as I call them. You want to be focused on your workout. It for the most part they should be they should be short. They should be focused. After an hour or so, concentration seems to wane. And also, with few exceptions, unless you're an endurance athlete, you just don't need to be working out for extended periods of time. So that's during the workout, and then afterwards, recovery. So make sure that you rehydrate. Make sure that you, if you did an intensive workout, replenish your glycogen stores. Uh, Protein, adequate protein consumption, especially for resistance training, especially for older athletes. Muscle protein synthesis becomes less efficient as we age. So adequate protein intake, and then finally sleep. That's the big thing. So hydration, nutrition, and sleep. Those are the big three for post exercise recovery. So thank you for the question. I didn't uh, wasn't anticipating that, but it was good for to keep me on my toes. Uh, Moving on, we talked about sleep hygiene. So let's say we're doing everything we can to get better sleep, get the right amount of sleep. How do we know when it's not working and it's time to start seeking medical guidance?
Yeah, absolutely. So there are some red flag symptoms. So the function of sleep is restorative. So if you're waking up in the morning and you're not feeling refreshed or restored, then that essentially means that there is something wrong with your sleep. It's just like accepting our kidney not making urine is normal, which is not. So that is when you should seek help. But that is not just like day to day, like one day of poor sleep or something like that. If something like that is happening consistently, then definitely you should seek help. There are some red flag symptoms that I would like to talk about or highlight. So one of those is loud and habitual snoring, especially if it is paired with witness pauses in breathing. That should prompt you to get some help. If you're feeling daytime sleepy, like falling asleep at work, during meetings, or behind the wheel, then you should seek some medical further seek for further medical workup and help. If you're having difficulty falling or staying asleep at least 3 nights a week, lasting more than 3 months, which is definition of insomnia, chronic insomnia, I should say, then you should seek some help. If you are having restless legs, which is uncontrollable urge to move the legs at night that prevents sleep, or if you are having behaviors like sleepwalking or violent dream enactment or frequent nightmares that disrupt your safety, then you should get help, get some help. So yeah, at that point, you should see a healthcare provider. And what to do next? Essentially, start with your primary care physician. They can screen with simple questionnaires like Stop Bank for sleep apnea or insomnia severities index, which is score for insomnia, and that might lead to a referral to a board certified sleep physician. And they would evaluate, and they would probably order some further sophisticated tests like sleep studies, which can be done at home or in the sleep lab. or they can order like actigraphy, which kind of measures your sleep quantity and sleep schedule based on your wrist movement. And then the treatments on basis of what they find, they can be life changes changing, because there are different treatment like CPAP therapy, oral appliance therapy. There is for obstructive sleep apnea. Then there is behavioral therapy for insomnia, which is CBTI, and lifestyle interventions. Um, so, but I should say that sleep problems, they're not just lifestyle issues, they're real medical condition, and they have highly effective treatment. And to give you an example, a 40-year-old truck driver who has high blood pressure and loud snoring, which are risk factor for sleep apnea, and is feeling sleepy, that person should not wait until they fall asleep on the road, because their early evaluation that could literally save lives.
So yeah, definitely. If it sounds like a lot of it is outcomes based. So how you're feeling in the morning? Are you awake and alert at work? It sounds like those are some of the red flags to look for, along with the other ones you mentioned. Snoring.
Yeah, and I should say, like, the reason I really love this specialty is that after, we intervene, we diagnose and treat, literally my patients tell me that there is day and night difference between their sleep quality and their daytime functionality. So these sleep disorders, they're not a life sentence. With the right diagnosis and treatment, most patients, they see improvement within weeks, sometime even days. So bottom line is, don't normalize exhaustion. And if you're if you have tried the basic of sleep hygiene and still wake up tired, and if you find one of these red flags that I mentioned, it's time to get evaluated.
Absolutely. Don't settle for feeling miserable. Get help. Let's talk about DIY, do-it-yourself sleep treatments. So there's a lot of options out there, from over-the-counter drugs to supplements such as melatonin. What advice would you give someone who's looking to self-diagnose or possibly self-treat?
So sleep is such a unique and universal experience that often people feel that they can treat problems on their own. You can walk literally into any pharmacy and you'll see entire aisles of sleep aids, from melatonin to herbal tea to over-the-counter medication. And to that, you add booming supplement industry, and it's easy to see why so many try the do-it-yourself approach before ever talking to a doctor. So, first of all, I would like to talk about melatonin, which is one of the most misunderstood substances. And many people think it's a sedative like a sleeping pill, but it's not. It's a hormone that tells your body when to sleep, not how well you sleep. And essentially, it's like a dimmer switch for your circadian rhythm. It helps with time zone shifts or night shifts. It's very effective with jet lag. It's very effective with shift work disorder, or people who have circadian rhythm disorders. But for chronic insomnia, the evidence is weak. And if someone takes melatonin at the wrong time, they can actually make their sleep worse, because again, it has a very strong relation with the core body temperature minimum. You take it before that, you will fall asleep earlier and earlier. And you take it after that, then it will, push, it will make you fall asleep. It will sort of like, push your sleep schedule behind, as in, like, it will make you, sorry, it will make you go to sleep earlier. Yeah.
Okay. Yes. So in other words, don't try this at home. Seek a professional. So
Yeah, and there are other things that I want to talk about as well. There are over the counter medication. So most common over the counter sleep aids, they're just antihistamines, which is diphenhydramine or doxylamine are the most common. There are the same drugs which are found in allergy medicine. So they can make you drowsy, but they're not natural sleep. These people who take it often feel groggy, foggy, and unrefreshed the next morning. And long term use is even more concerning because there is research that links chronic use of anticholinergic drugs like this to memory problems and even increased dementia risk. So, when you knock yourself out with these antihistamines, you're sedated, not truly sleeping. Then if we talk about like, the supplement industry and the herbal remedies, there are so many. There are herbal teas, valerian root, magnesium, CBD. These are all heavily marketed. The problem is not that they're harmful in small doses. It's that the evidence is inconsistent and the quality control is poor. And because they're not like, FDA regulated, so what's on the label, it's not what's in the pill. And the way it is in prescription medication, and there is big dosage alteration. So for example, even melatonin, it is not regulated by FDA. It's over the counter supplement. And there was a study that actually tested different melatonin pills on the market in the same listed dose, and they found like, it had like, about 30% sorry, 90% less to like, 400% more within the same dose. So what's listed on the label is not essentially what you're getting. And then there is risk with self-diagnosis because you may miss a serious condition. So, for example, if someone has insomnia, they're waking up multiple times in the middle of the night and not able to fall asleep. They might have untreated sleep apnea, but they might try melatonin or teas while their oxygen levels are dropping every night. So it's just like putting a band-aid on chest pain without ruling out a heart attack. And then most of these people, they take these over the counter medication for chronic insomnia. So chronic insomnia itself can be a sign of anxiety, depression, or other medical disorder. And these over the counter medications, they can mask symptoms rather than solve them. But if I talk about it, the gold standard treatment of insomnia is not a pill. It's something called cognitive behavioral therapy of insomnia, which I would like to talk to you in detail about.
Yes, please do this. We'd love to hear it.
So, let's start with like, how we learn to sleep. So, sleep is a learned behavior. We don't know that. When we are putting kids to bed, essentially we are making them learn how to sleep. Because, by the time they are ready to go to bed, their sleep pressure is has peaked. They are like, tired from jumping around all day long. And you put them into bed, the room is dark, quiet, and they go to bed and they're tired. They have their sleep pressure at the peak, so they fall asleep. Okay. And then they get a pretty good sleep, right? And that's why it's called sleeping like a baby. And once they get up, what do they want to do? They want to jump right out of the bed. They don't want to stay in the bed, right? So what happens is essentially that their brain starts pairing the bed with sleep. Okay. So our brain works in very simple ways. It works by just like, pairing, right? At least mine does. So as we grow older and older, we start accumulating some maladaptive behaviors, which could be well intentioned in the beginning, like, reading in bed or watching TV in bed or, worrying in bed or tossing and turning in bed. And all of this leads to more wake time in bed. And then brain starts pairing those things with sleep, like, worrying or like, oh, I'm in bed. I need to like, doom scroll or whatever, or I need to read or watch TV. So, in that association of bed with sleep is lost. So, essentially, insomnia is a disorder of hyperactive brain in bed, which is like, further exacerbated by like, these maladaptive behaviors. And as I told you, that sleep is a learned behavior, that the good news is that it can be relearned or it can be retrained. And that retraining process is something called cognitive behavioral therapy for insomnia, CBTI. Um, so it's different from traditional cognitive behavioral therapy. It's not like, someone is going to make you sit in a couch and talk to you about your family relationship or your childhood trauma. Not that I mind that, but it's a form of therapy that really is targeted and focused on behaviors around bedtime. And, what it does is that breaks that psychological behavioral hyperactive cycle, which I did just describe to you. And that's how it cures insomnia. And unfortunately, we have not been able to develop a pill, which breaks that psychological behavioral hyperactive cycle. So I tell everyone that treating insomnia is just like going to a gym. You have to put in a work. There is no like, magic solution that will like, make you stronger or make you well built. You have to be disciplined. You have to do the same boring thing again and again. And the CBTI, that is the form of therapy that guides you and gives you necessarily all the tools you need to deal with that insomnia.
So it's like everything else. There are no shortcuts. You just got to do the work. Uh, let's talk about, we touched on this earlier, the societal costs of poor sleep. So what does it do in terms of workplace productivity, medical costs, public safety? What are the societal consequences of poor sleep?
Yeah, there is a big societal cost. Actually, the Rand Corporation, they did a landmark study which estimated that insufficient sleep cost the US economy over $400 billion every year. And that is all through lost productivity, absenteeism, presenteeism. So people showing up to work but not functioning at their best. So to put that in perspective, sleep loss cost us more than many chronic diseases which we routinely focus on, like diabetes or heart failure. And when companies or corporations they ignore sleep, they pay for it in the form of burnout, higher health care claims, and turnover. So essentially, a sleep deprived workforce is not a competitive workforce. Talking about public safety, its impact on public safety. So if we talk about drowsy driving, that's just as dangerous as drunk driving. And CDC estimates that 1 in 25 adults has fallen asleep at the wheel in the past month. Every year, drowsy driving causes thousands of crashes, injuries, and death. And in industries like healthcare, aviation, or trucking, fatigue can literally mean like life or death. If you look at Challenger disaster, the Chernobyl, all like of these like major error-related disaster in those like lack of sleep or fatigue, it played a role. So, essentially, I tell everyone that, we would never let a pilot fly drunk, but, we often let people do important things like, even in my profession in healthcare, like, we let doctors work on poor sleep, particularly in the residency training. That's very unfortunate. So we talked about societal impact, we talked about public safety, and then there is a big healthcare burden um, because poor sleep it's linked to almost literally every chronic disease like heart disease, hypertension, diabetes, obesity, depression, anxiety, dementia. And people who sleep less than 6 hours per night, they have a much higher risk of heart attack and stroke. It also drives healthcare utilization, more ER visits, more hospitalization, longer recovery time, and insufficient sleep. It even it does suppress our immune function, and there are multiple studies in that which have shown like that if you vaccinated people who had insufficient sleep, they did not mount a robust immune response. So yeah, like there are so many benefits of sleep deprivation or poor sleep due to sleep disorders. that sleep is something that should always be a part and parcel of your total healthcare and longevity plan.
So we talked about the societal impact of poor sleep. In terms of public policy and societal change, we touched on this a little bit earlier. We're starting to see some progress on certain fronts, like school start times being moved to later in the day for adolescent, teenage kids. What still needs to be done at the societal level to ensure better sleep?
Yeah, I'm very glad that you mentioned school start times, because American Academy of Sleep Medicine, which is our premier organization for all the sleep physician, it is working on advocating for delayed school start times. And also American Academy of Pediatrics, it recommends that middle and high school they start no earlier than 8:30 a.m. Why? So the reason behind that is that teenagers, they have biologically delayed circadian rhythm. So by that, what I mean is that they naturally fall asleep later and then they wake up later. So forcing them to wake up at 6 a.m. is like adults asking adults to show up at work around like 3 a.m. in the morning. And then the research and data behind that is powerful. The schools that delayed start times, they saw improved attendance, they saw higher GPAs, they saw lower depression and anxiety rates, and they saw what was very important and actually eye-opening for me, um, reduced car accident rates among teens. So the CDC reported a 70% reduction in car crashes in some district that shifted start times. So if you think about that, changing the school bells, it saves more lives than any pill that I can prescribe. So that is about school start time. But the workplace is another frontier. And unfortunately, we glorify sort of the hustle culture, that I'll sleep when I'm dead sort of mentality. And it is costing us billions in healthcare and productivity losses. And safety sensitive profession like truck drivers, pilots, and healthcare worker, they're particularly vulnerable. And it's a leading sleep deprivation is a leading cause of medical errors and accident. So we need to have workplace reforms which allow flexible scheduling that respects circadian biology, because honestly, it's some people, based on their chronotype, are either, if I lump them into like three main groups, either they are night owls, or they are morning larks, or they are neutral. So we as a society, I feel like punish people who are night owls, which is not due to their fault. It's in their genetics. So really, we need to have, as a society, flexible scheduling that respects that circadian biology. Need to have a nap friendly environment in high risk jobs, like medical doctors during training or air traffic control. And we need to realize that, um, and have that recognition that productivity, it's not just about hours work, but it's about hours rested.
It's you're absolutely right about. I can certainly attest to the what I call the false machismo that takes place in the workplace. How we glorify, unfortunately, still glorify poor sleep and sleep deprivation. Let's move on to sleep tech and sleep tracking. So this could actually be a whole nother discussion because you're so active in so many different things, technology, AI, wearables. But let's just touch on one aspect that might hit home most closely to our listeners. What should our listeners know about wearables and sleep tracking devices?
Yeah, so sleep tech, it's one of the fastest growing frontiers in medicine, and I've been very fortunate to work with a lot of these. So everything from consumer wearables like smartwatches and rings to clinical grade home sleep testing. So what general public need to know is that, so these wearables, they are trend trackers. They're not diagnostic tools. So you can think of them like your bathroom scale, The scale will tell you, like, if your weight is trending up or trending down, but the scale would not tell you your grip strength. That scale will not tell you your body fat composition. The scale will not diagnose your thyroid disease or diabetes. So similarly, the wearable, it can give you insight about trends, whether you're sleeping longer or shorter, whether your sleep is more fragmented, but it will not tell you why is that, or it will not replace a formal sleep evaluation or a formal sleep study. So, um, to put in another way, your Apple Watch is not your sleep doctor, but it might be a wake up call to see one. And then, talking about accuracy of these devices, it's improving, but it's still imperfect. So most of these wearables, they rely on motion, mostly like wrist motion, which is actigraphy. They rely on heart rate, sometimes blood oxygen level. So they are getting better at estimating stages, but they're about, like, 70% accurate as compared to a diagnostic sleep lab study, which is not enough for medical decision, particularly in people who are at low probability or low risk. Um, and also these wearables, they overestimate sleep in people with insomnia, because if you're just lying still, but you're awake, it looks like light sleep to these devices or these trackers. But on the other hand, they have incorporated newer sensors like SpO2 heart rate variability, which are getting good at flagging risk for sleep apnea or arrhythmias. But there is something I have seen, and a lot of sleep community has seen since these trackers came in, which is the risk of orthosomnia, which is a fancy term which we have coined. So orthosomnia is actually insomnia due to worry about the tracker data, or to get max sleep score on their tracker. So, like, we call it orthosomnia, but by worrying about that data, and by forcing yourself hard to get that perfect score, you are actually adding energy into a system which requires least amount of energy. So, like, if you wake up and your ring tells you that you only had 4 hours of deep sleep, it can cause unnecessary anxiety. And I see it all the time, like, in the sleep clinic, like, my sleep is just this much. And I'm worried about that. But I feel fresh when I wake up in the morning. So, and a lot of time people, they, like, as human beings, due to evolutionary reasons, um, our we focus more on negative data, like, um and so it's like, these sleep stages vary night to night. um so you need not worry about, like, every night sleep score. And then coming about where these variables are most useful. So I tell my patient to use it as a motivation tool. They can help build awareness of sleep pattern. They can reinforce healthy routine, bedtime regularity, reduce screen time. They can provide data that prompts real medical evaluation if something looks off. And honestly, if a wearable nudges someone to finally see a sleep doctor, I think it has already done its job.
Wow, fascinating. And I think we called it autosomnia, the law of unintended consequences. When uh, fortunately, they can cause us distress about sleep more. So, fascinating unintended consequence. Moving on, the lightning round. What's one sleep myth that you'd like to go away or at least quit hearing about?
Yeah, so the myth number one is the idea that you can catch up on sleep over the weekend. So the truth is, you can recover a little from a late night but this chronic sleep debt, it kind of compounds. But in addition to being compounded, it cannot be repaid like a bank loan. So there are studies which have shown that people who shortchange sleep during the week, they still carry impaired attention, reaction time, even changes in metabolism into the following week, even if they oversleep on Saturday and Sunday. So it's just like nutrition. Like literally, you cannot starve yourself all week and then feast over the weekend and expect your body to work normally. The body thrives on rhythm and regularity. So we need to have 7 to 9 hours of sleep consistently, and not trying to play catch up. The myth number two is that I can sleep when I'm dead. The so the reality is that chronic sleep deprivation, it gets you there faster. It shortens lifespan and it accelerates chronic disease. So I tell this to everyone that sleep is not lost time; it's invested time. Your brain and body are doing their repair work while you rest. So it's the best investment in yourself.
Yes, absolutely. Feel the same way about exercise. What's a favorite book, blog, or podcast, sleep or non-sleep related, that you recommend?
So sleep related book I recommend is Why We Sleep by Matthew Walker. It's a very nice book. I don't know, like, for general public, if they have good motivation to read through the book. But it is a book which sparked global awareness of sleep's importance. People who are struggling with sleep and want to have struggling with insomnia and want to learn more about CBTI, which is the therapy I told you, they can read a book called Say Goodnight to Insomnia. That is by Dr. Greg Jacobs, and he's a sleep psychologist. In that book, he talks about how you can utilize that therapy, CBTI, to retrain your brain how to sleep. So outside of sleep, my favorite books is *Sapiens* by Yuval Noah Harari, and it is a book which reshaped how I think about human history, society, and the stories we tell ourselves um, about culture and health. Um, so that is about the books. In the podcast world, I enjoy listening to Huberman Lab, and that's not because I agree with everything he says, but because it makes neuroscience and physiology accessible to general public and sparks curiosity. And that curiosity is what drives better health decisions.
The one thing that we talk about on this podcast, it's not just about health; it's about growth and development. So, what advice would you give to young people, aspiring professionals in medicine or other fields, or what advice would you give to your younger self?
So honestly, I did not realize about this till I finished my sleep fellowship. But if I could talk to my younger self, I'd say that don't glorify hustle culture. Protect your sleep the way you protect your wallet. The money can be regained, but health and lost years they cannot. And for younger people today, whether you're a student or early in your career, realize that sleep is not wasted time; it's investment time, as I told you. So those are the hours when your brain consolidates memory, your heart and immune system repair, your metabolism resets. So it's the most powerful and affordable performance enhancer we know of. So guard it as your edge in both health and success.
Well, thank you for that. And finally, wrapping up, we talked about some of the resources where listeners can go to learn more. Is there anything else they should be following, and how do they follow you and learn more?
Yeah, absolutely. First of all, I want to thank you and your listeners for spending this time talking about sleep. Because for me, sleep is not just about rest, it's about health, safety, and longevity. So, we covered a lot of ground today, from how sleep medicine evolved to what practical steps people can take in their daily lives. And my hope is that everyone leaves this conversation with at least one actionable step to protect their sleep tonight. um, and if you like to continue learning, there are few ways to connect with me. I share regular insight, commentary on new research and practical tools, mostly on LinkedIn, where you can find me under my social handle, Sleep Warrior MD, or with my name. I'll provide you with a link as well if you want to put that in the show notes. I have the same handle on Instagram and Facebook, but I'm most active on LinkedIn. I also write longer form articles on Medium, diving deeper into how sleep interacts with heart health, brain function, mental health, and future of digital health and AI in medicine. For healthcare professionals, I often speak at national conferences and local conferences and contribute to panels and symposia, and you may see me there as well.
I can certainly attest to the quality of your posts on LinkedIn. That's how we met, and I follow you eagerly and
Thank you.
look at your posts with great enthusiasm. So, Dr. Usama, it's been a true honor to have you tonight and to talk about this topic that we're both very passionate about. So, I'd like to thank you again. I'd like to thank you again for joining us today.
No, absolutely. It was a pleasure, and thank you so much for having me.
You're very welcome. Take care. Have a good night. God bless.
Take care. Bye.